Prime Minister Narendra Modi has said that all Indians will be vaccinated once the coronavirus vaccine is available and no one will be left behind. Prime Minister Modi expressed that a national expert group has been created to manage vaccine administration and to chart the way ahead. Speaking to the Economic Times in an interview, Prime Minister Narendra Modi said, "I would like to assure the nation that as and when a vaccine becomes available, everyone will be vaccinated. No one will be left behind." Prime Minister Modi further added, "Of course, initially, we may focus on protecting the most vulnerable and the frontline workers." A national expert group on vaccine administration for COVID-19 has been constituted to chart the way forward, he said. Speaking on the massive exercise of taking the coronavirus vaccine to the entire population of India, Prime Minister Modi said, "On logistics, more than 28,000 cold chain points will store and distribute COVID-19 vaccines to ensure they reach the last point. Dedicated teams at state, district and local levels will see to it that vaccine distribution and administration is done in a systematic and accountable manner." However, Prime Minister Narendra Modi added that the coronavirus vaccine is still a work in progress and trials are on. Covishield, a vaccine candidate that has shown promise during trials, may be ready by December 2020. Serum Institute of India CEO Adar Poonawalla told News 18. He, however, added the caveat that a lot is subject to data from the UK and also a lot depends on the approvals coming from the Drugs Controller General of India. Covishield, developed at the Jenner Institute of the Oxford University in the UK and licensed from Anglo-Swedish drug maker AstraZeneca, is currently undergoing the final phase of clinical trials in India among nearly 1,600 people. Serum has floated a new company, Serum Institute Life Sciences, that will exclusively focus on developing, producing and supplying pandemic vaccines. Poonawalla termed as preliminary good news an announcement by British drug maker AstraZeneca that an experimental COVID-19 vaccine being developed by the University of Oxford is producing an immune response in both younger and older adults. While strongly denying that community transmission of COVID-19 was taking place in Nagaland, the Department of Health and Family Welfare reasserted that new cases were instead due to local community spread and urged people not to be confused between the two. Addressing media persons, Principal Director of Department of Health and Family Welfare Dr. Vijole Shukre said, "Though the infection was spreading within the community, yet we have not reached the community transmission stage." He also said COVID-19 cases were linked to primary contacts, even though there was increasing trend in COVID cases in the state. While drawing attention to social media buzz that another lockdown was imminent due to spread of COVID-19, Dr. Shokre clarified that the department did not want to reimpose another lockdown. Meanwhile, Dr. Shokre revealed that Nagaland was not prepared to host any festival. He said virtual festival could be encouraged, but that there should not be a normal mega festival organized during the pandemic. Imphal-Dimapur section of National Highway 2 reopened yesterday for vehicular movement with the completion of the diversion route. The highway, the lifeline of Manipur, remained cut off for the last 4 days owing to a massive landslide at Khongnam Thana in Senapati district on October 23rd evening. The landslide had completely damaged around 50-meter stretch of the road, which compelled authorities manning the highway to cut a temporary diversion route for resumption of normal vehicular movement. State PWD and other authorities manning the highway swung into action to construct the temporary diversion road by pressing their available manpower and machineries to undertake restoration work. The work was, however, completed ahead of the expected schedule, said State PWD Chief Engineer Thongbram Ravindra Kumar, who informed about the reopening of the highway for normal vehicular movement from Wednesday morning. A week after the fortnight-long Assam-Mizoram border dispute was purportedly resolved, the issue resurfaced as agitators in Assam blocked National Highway 306, the lifeline of Mizoram, demanding the state withdraw its security personnel from Assam's territory. Police officers in Assam Silchar said that over 100 people blocked the highway at Lailapur, leaving more than 100 goods-laden vehicles stranded on either side of the border. The agitators were demanding withdrawal of Mizoram's forces from Assam's territory in Kachar and Karimganj districts. In the series of high-level meetings last week, the Mizoram officials had agreed to gradually withdraw their forces from the areas inside Assam territory. But they are yet to withdraw, a senior Kachar district police officer said. Festering since earlier this month, the situation along the 164-kilometer Assam-Mizoram border took an ugly turn, with around 20 shops and houses being burned and over 50 people injured in the attacks and counter-attacks by people on either side on October 17th. Popular instant messaging platform WhatsApp was the most commonly used medium by schools to send learning materials to students during COVID-19 pandemic-induced lockdown. The Annual Status of Education Report ASER 2020, facilitated by education-focused non-governmental organization Pratham, showed that this was true for both government schools and private schools. The ASER 2020 report said WhatsApp was by far the most common medium used for sharing learning materials and activities, followed by phone calls and visits. Here, a higher proportion of students enrolled in private schools received materials through WhatsApp than their counterparts in government schools. Accessing materials and opportunities via phone calls or visits was more common among children enrolled in government schools. The survey was conducted over phone in September 2020 across 584 districts across 30 states and union territories. It reached a total of 52,227 households and 59,251 children in the age groups of 5 to 16 years, as well as teachers or head teachers from 8,963 government schools offering primary grades. The organizers of the 2022 FIFA World Cup in Qatar are expecting more Indian eyeballs than during the 2018 edition, as the matches will be played at convenient timings for the audience in the country. The CEO, Nasser Al Khattat, said, Qatar will become the first country in the Middle East to host the mega sporting event, which will kick off from November 21st, 2022. In India, majority of the matches will kick off at convenient times. During group stages, the first game will start at 3:30 in the afternoon and the last game at 12:30 midnight. The second and third matches at 6:30 and 9:30 Indian Standard Time respectively, which will both be consumed by primetime evening broadcast audience in India, Qatar said. Qatar is committed to deliver an affordable and exciting experience to anyone who visits the country during the World Cup in 2022. With positive cases rising all across the nation, the COVID-19 status of northeastern states are: like, subscribe, and hit the bell icon for news that matters and stories that inspire.